I'm a consultant plastic surgeon with 18 years experience and 6 years training in a higher surgical training post. I'm a member of the British Association of Aesthetic Plastic Surgeons and the British Association of Plastic and Reconstructive and Aesthetic Surgeons.
I had a car accident about 2 years ago and I had some facial issues and my nose was affected.
I had very heavy eyelids and very heavy eyes and no upper eyelids at all, and they made me look older, much older, and very tired all the time. It was something that I hadn't liked about myself for quite some time, really.
It was just about finding the right person that made me feel comfortable enough.
I think it's important when choosing a plastic surgeon to know what their training has been, to know a little bit about their experience, but the most important thing is a recommendation either from the general practitioner or perhaps from a friend who's had treatment by that surgeon.
You get a really balanced view. You don't feel like you're being sold something.
My first consultation is a very open consultation, listening to what they want and then giving them a basket of information that they could just go away and think about.
He was very realistic. He didn't say, you know, it will be this.
You must make sure that the patient is fully informed as to what they're getting themselves into before they actually commit, and that's part of the informed consent process.
Any of the queries, questions that I had, he was able to answer fully for me.
So when they come back, I quite often find that the patients are much more settled, they're much more receptive to receiving information, and we can have a much more fruitful discussion about what are the potential benefits and risks of the operation.
Having surgery has given me back the confidence that I had before, because now the way that I feel and have always felt about myself on the inside is now sort of more reflected on the outside. I'm
now wearing eye makeup, whereas I couldn't wear any because I didn't have any eyelids to put makeup on, so that's so much better.
I think one of the most gratifying things for me is to see the patients coming back after their operation and once they've recovered, to seeing much more positive mental attitude, a change in their posturing, much more positive attitude to their life, and that's very rewarding for me.